In the 2 weeks since the state fully reopened, there has been a noticeable rise in COVID cases.
Let's take a look back. According to the California Department of Public Health, back on June 1st, there were less than 1,200 new cases reported. When the state reopened fully on the 15th, there were fewer than 1,000 cases. A week later, that number rose to 1,100. And yesterday, the final day of the month, and 2 weeks after the reopening, that number has jumped to nearly 1,700 cases. That spike is also being felt here in the Bay Area.
Health officials say it is largely the unvaccinated population testing positive, while the Delta variant is mostly to blame. Crown 4's Michelle Kingston has more.
I think, as expected, as we continue to reopen, cases of COVID-19 are increasing somewhat.
Many counties across the state of California are seeing a rise in COVID-19 cases. Several Bay Area counties have seen an increase since the reopening of the state, including San Francisco and Alameda County. Officials there say with more businesses and activities open and more people socializing with other households, these increases are not unexpected and reinforce the urgent need to continue vaccinating and for continued masking among unvaccinated residents in indoor public settings and outdoor crowded spaces. COVID-19 is still circulating in our communities, and unvaccinated residents are susceptible to severe illness, hospitalization, and death.
If you're unvaccinated, you need to be careful. You need to wear masks. You need to avoid indoor crowds. You need to avoid situations in which there might be transmission, because there's nothing if you're unvaccinated, there's nothing new. It's just that there are fewer people who are susceptible. But if you congregate together, the unvaccinated people congregate together, there's nothing to say that we can't have that kind of super spreader events that we had last year.
Dr. Grant Colfax, the director of health for the city and county of San Francisco, says it's the Delta variant that is concerning, especially heading into the holiday weekend.
With the Delta, which is basically COVID on steroids, this is not a good time in San Francisco, even with our high vaccine rates, to not be vaccinated. It's hard to predict the future, but I would say that I think that it's a combination of more activity and this Delta variant. It accounts for about 30% of cases that we have in San Francisco right now. It's doubling every 2 weeks. So I would expect to continue to see cases increase.
Michelle Kingston, Cron 4 News.